Have you ever walked out of a doctor's office feeling like something was missing, even though the visit seemed fine on the surface? You got your blood pressure checked, your medications were reviewed, and the doctor nodded politely. But still, something didn't sit right. Maybe you felt brushed aside. Maybe your questions weren't fully answered. Or maybe you felt like they already had their mind made up the moment they saw your age on the chart. You're not alone. Many older adults experience this quietly. They may not talk about it, but they feel it, the sense that doctors sometimes see age before they see the person. It's a difficult thing to admit, but it happens more than most people realize. And the truth is, these unspoken attitudes can affect your care in real ways. Whether it's being told that's just aging or not being offered certain treatments, these moments can change how you feel about your health and your future. That's why in this video, I want to share 5 eye-opening truths about what some doctors really think about older patients. Not to scare you, but to help you feel more confident, more informed, and more in control when you step into that exam room. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Number 1, they often assume your symptoms are just because of age. Let's be honest, when something in your body starts to feel off, you know it. Whether it's a new pain in your knee, unusual tiredness, or changes in your memory, you can feel that something's different. But too often, when older adults like you walk into a clinic or doctor's office with a concern, the answer you get sounds like this: well, that's just part of getting older. And that's where the problem begins. This kind of response can feel dismissive, like your concerns don't deserve real attention. You may walk in hoping for answers and leave with nothing but a smile and a pat on the back. But what if that joint pain isn't just aging? What if that shortness of breath is something more serious than slowing down? What if your forgetfulness isn't just senior moments, but actually a reaction to a medication or a sign of something treatable? The issue here is not just about what the doctor says, it's about what gets missed. When someone chalks up your symptoms to age too quickly, they stop looking for deeper answers. And that means you could go without the right tests, the right diagnosis, and the right treatment for weeks, months, or even years. That's not just frustrating. It's dangerous. Let me give you an example. I once knew a man named Robert, 82 years old, still sharp and independent. He started feeling extremely tired and a little dizzy. His doctor said, "You're just slowing down. Rest more." But Robert felt in his gut that something wasn't right. He pushed for more testing. Turns out, he had a heart valve issue that could be fixed. After treatment, his energy came back, and he said he felt 10 years younger. Imagine if he hadn't spoken up. That's why it's so important to trust your instincts. If something doesn't feel right in your body, it's okay to ask for more testing. It's okay to say, "Can we take a closer look?" Aging is real, but it's not a blanket answer for everything. You've lived long enough to know your body, and your voice matters in that doctor's office. Never forget that. Number 2, they may believe you won't follow the treatment plan. There's something many older adults don't realize is happening behind closed doors, and it's this. Some doctors, whether they admit it or not, believe that people over 60 are less likely to follow instructions. That means they may assume you'll forget the details, mix up your pills, or just not bother trying certain treatments. And because of that, they might choose to give you a simpler, shorter, or even less effective plan. Now let's pause here. This isn't about blaming doctors. Some of them genuinely think they're making things easier for you. But the problem is, when they expect you to struggle, they might not even give you the full picture. They might leave out certain medications, skip explaining newer therapies, or avoid giving you lifestyle recommendations like exercise or diet changes. All because they assume it's too much for someone your age to handle. But here's what we both know, that assumption is wrong. Many older adults are incredibly capable, sharp, organized, and proactive. You've managed a household, raised families, handled bills, and made big decisions your whole life. So why wouldn't you be able to follow a care plan if it's explained clearly? I remember a woman named Carol. She was 79 when she was diagnosed with a heart condition. Her first doctor gave her a basic plan with just one medication and told her not to worry too much. But Carol wanted to be involved. She wanted to know more. When she found another doctor who sat down with her, explained everything in plain language, and gave her a full range of options, she followed that plan better than most 40-year-olds would. And her health improved dramatically. What's the lesson here? Don't let anyone decide for you how much you can handle. If your doctor skips over the details or keeps it too simple, speak up. Ask for everything you need to know. Say, "Can you explain all my options?" or "I'd like written instructions to keep track." Even bringing a notebook to your appointments shows you're serious about your health. And if something feels confusing or unclear, ask again. You are not a burden for wanting answers. You are showing strength and responsibility. The more you show your doctor that you're involved, the more seriously they'll take your care. Age doesn't make you forgetful or lazy, and you deserve a plan that reflects your full potential. Number 3, they may prioritize younger patients without realizing it. This one is hard to talk about, but it's real. In busy hospitals or clinics, when doctors are under pressure and have limited time, some of them start making silent choices about where to focus their energy. And often, without saying it out loud, they prioritize younger patients. The reasoning goes something like this: they have more years ahead, let's give them the more aggressive treatment. But where does that leave you? It can leave you waiting longer. Being offered fewer options. Or being told, you don't really need that test, when someone 20 years younger in your same condition would have gotten it immediately. And this doesn't just happen in emergencies. It happens in regular checkups, surgeries, and even follow-up care. For example, I knew a man named Richard, 82 years old, who was very active, walking every morning, gardening, doing everything he could to stay healthy. But when he developed severe knee pain, his doctor told him surgery was too risky for someone his age and prescribed only pain medication. That answer didn't sit right with him. So Richard found another doctor, one who actually listened. After reviewing his full health profile, not just his birth date, the new doctor said, "You're a great candidate for surgery." Richard got the knee replacement, recovered beautifully, and was back on his feet doing the things he loved. The problem here is that age gets treated like a barrier, when really, it should be just one piece of the puzzle. Your lifestyle, mindset, support system, and overall health matter just as much, and sometimes more. Doctors don't always mean harm when they prioritize younger people. Sometimes, they're thinking statistically. But you are not a statistic. You are a whole person with a life still worth living fully, not just comfortably. So what can you do? Be clear about what you want from your care. If you feel a test or treatment is being skipped because of your age, ask directly, "Would you recommend the same thing if I were 50, or, can you explain why this option isn't being offered to me?" And don't be afraid to get a second opinion. Good healthcare isn't about rushing decisions, it's about making the right ones for you. You have the right to be seen, heard, and treated based on your health and goals, not just your number of birthdays. Number 4, they may assume you don't have big goals anymore. This one might surprise you, but it happens quietly in many exam rooms. Some doctors, often without realizing it, start to believe that once you're in your 70s or 80s, your dreams are behind you. They assume your focus is just staying comfortable, avoiding pain, or making it through the week. And because of that belief, they may not take the time to ask what really matters to you anymore. But let me ask you this, do you still have goals? Maybe you want to travel. Maybe you want to dance at your granddaughter's wedding. Maybe you just want to walk to the park without pain or cook your favorite meal without getting tired. These aren't small things. These are the things that make life feel like your life. When a doctor assumes your only goal is survival, not joy, they may give you the quickest fix instead of the best one. They might offer a pill to dull the pain instead of exploring therapy to help you move freely again. They might skip the in-depth conversation because they think you're not interested in all that. But that's not fair, and it's not true for so many older adults. I once knew a woman named Ellen, 81 years old, who had a chronic lung condition. Her doctor told her to stay home, rest, and focus on comfort. But Ellen had a dream, to fly overseas and visit her granddaughter. She found another doctor who didn't just look at her condition, he looked at her desire. He helped her prepare with better medication, breathing exercises, and a travel plan. 6 months later, Ellen made that trip, and said it was the happiest she had felt in years. That's why it's important to speak up about what you want in life, not just what hurts. Tell your doctor your hopes. Say, I want to get strong enough to walk every day again, or I'm working toward going on a family vacation. When you do that, it reminds them that your care isn't just about managing symptoms, it's about helping you live fully. Because you're not just a patient. You're a person with history, purpose, and things still left to enjoy. And those goals, no matter how big or small, deserve to be part of your healthcare plan. Number 5, they may overlook how aging affects you emotionally. When most people think about going to the doctor, they expect the focus to be on blood pressure, test results, aches and pains, the physical stuff. And while that's important, there's something just as serious that too many doctors ignore: your emotional well-being. Especially as you grow older, your emotional health becomes deeply connected to how your body feels and functions. But sadly, many doctors don't ask about it at all. They might not ask how you're coping with loss. They might not notice the loneliness you carry. They may never bring up how your sense of identity has changed, after retirement, after losing a spouse, or after having to slow down in ways you never expected. Instead, they focus on pills and numbers. And in doing so, they miss a big part of the picture. I once met a man named Leonard. He had been married for 54 years. After his wife passed, some recovery time. And when sadness, stress, or isolation go unspoken, they don't disappear. They grow quietly in the background and make healing harder. But if your doctor isn't asking, that doesn't mean you have to stay silent. If you've been feeling down, anxious, or alone, even if you think it's just part of life, say something. Bring it up at your next appointment. It's not complaining. It's not weakness. It's taking care of your whole self. A good doctor will listen. A great one will help. And if they don't? It's okay to find someone who does. Because your emotional well-being is not a side issue, it's a central part of your health. You've earned the right to be cared for fully, body, mind, and soul, no matter what age you are. If you've stayed with me through this entire conversation, then I want to tell you something important, something I don't think older adults hear enough: you matter. Not just your chart, not just your medical history, not just your age, you, the whole person. Your voice, your story, your experience, your future. It all matters. Hearing these 5 truths might have stirred up some emotions. Maybe you've nodded along because you've lived through some of these situations, feeling brushed off, ignored, or underestimated. Or maybe you're feeling a bit frustrated now, realizing that you've accepted things you shouldn't have had to. Wherever you are emotionally, let me say this clearly: this isn't about blaming doctors or creating fear. It's about giving you awareness, because awareness leads to confidence, and confidence leads to better care. The next time you walk into a clinic or doctor's office, I want you to walk in with your head high. Ask the questions. Share your goals. Speak up when something doesn't feel right. Don't accept "you're just getting older" as an answer if your gut says something more is going on. Don't be afraid to say, I still have things I want to do, help me stay strong for them. If a doctor won't listen, find one who will. If you don't feel taken seriously, get a second opinion. You are not being difficult, you are being smart. You've lived too long and come too far to settle for anything less than full, respectful care. Because the truth is, some of the best health outcomes happen when doctors and patients work together, as a team. And every great team starts with clear communication and mutual respect. So never forget that you are not a passive patient, you are an active participant in your health. And that mindset can make a world of difference. So now I want to hear from you. Was there something in this video that stood out to you personally? Maybe one of these 5 truths reminded you of an experience you had, or changed the way you'll speak to your doctor moving forward. Whatever it is, please share it in the comments below. Your story might help someone else feel a little less alone. If this video helped you feel informed, encouraged, or just a little more confident, please like, subscribe, and share. Your support means everything. And remember, your health, your dreams, your dignity, they still count. Maybe now more than ever.